Hi everyone, welcome to my video presentation on anaphylaxis and EpiPen. After watching this video demonstration, you'll be able to recognize signs and symptoms of an anaphylactic reaction, as well as safely and effectively administer epinephrine using an EpiPen auto injector. Before we get started in discussing how to inject the epinephrine using the EpiPen auto injector, just wanted to do a quick review of what anaphylaxis is. An anaphylactic reaction is a life-threatening emergency allergic reaction that usually involves a full body response and can cause respiratory symptoms, symptoms on your skin that involve the heart, stomach, and at times your neurological system. So with the airway, you might see that the person who is in need is having some coughing, shortness of breath, wheezing, difficulty breathing in general. A lot of times feel like their throat is closing off. A mild reaction would be itchiness to the throat. Their skin you might notice some hives, swelling, redness, even warmth to touch. Their stomach, they might complain of nausea, vomiting, and even stomach cramps. Their heart, they might tell you they feel like they're having heart palpitations. They might feel dizzy, they might feel faint, and in worst cases, you will see some loss of consciousness as well. And as far as their neurological system, it's more of an emotional response. They'll feel anxious, confused, like something really bad is going to happen, and we refer to that as an impending doom. So what might be causing this is an important piece of information as you're trying to recognize, is this an anaphylactic reaction or not? Common triggers include foods, medications, vaccines, insect stings, and exposure to latex. Foods are the most common. People might be allergic to peanuts, shellfish, eggs, dairy. Medications, if a person's having an allergic reaction to a new medication, it's important to know that. Insect stings are also common. Bees and wasps are your top common causes. So what is an EpiPen? EpiPen is a brand name for this auto injector that administers a measured dose of epinephrine. Epinephrine works in the body system by relaxing the respiratory muscles. It also causes your blood vessels to tighten up or constrict, which will help your blood pressure rise, and it also helps by reducing swelling. So first things first, if you do suspect that the person is having, or yourself is having, an anaphylactic reaction, you're going to want to call 911. This is an emergency. You want to make sure that the medical response team is on their way before even treating, and sometimes simultaneous. This can happen simultaneously. So if you're with other people, you can have someone call 911. You yourself can call 911 if it's for yourself, and get ready to inject the epinephrine. So now for the fun part, how do we inject epinephrine? So here's the EpiPen. This looks exactly like a real EpiPen. The only difference is that this is a trainer. It's clearly labeled as trainer. There's no active medication and no needle in this device. It's used only for the sole purposes of modeling giving the epinephrine injection so as to make you comfortable and competent in doing so in case of an emergency. So it comes with this blue top and this orange bottom. Blue to the sky, orange to the thigh. Okay, always remember that. So first things first, you're going to want to remove that blue top. It's your safety guard, and that's what's going to allow you to administer the medication. If that blue top is on, you will not be able to administer the medication. The orange portion goes to the thigh. You put it at a 90-degree angle, it says on your flyer, about 10 centimeters away from the outer mid-thigh. You don't have to measure, eyeball it. You want to go kind of mid-thigh here, okay? And you're going to push it up against your own thigh or the person who's having the reaction, and you should hear or feel a click, just like that. Once you hear that, that means the medication is being administered. You're going to hold it in place for about 10 seconds. Let that medication fully be administered. And once that 10 seconds is through, you're going to go ahead and pull that right straight out. And then you're going to massage the area for about 10 seconds. At that point, hopefully you have your medical response team on their way, and hopefully you have helped this person's symptoms start to subside and help them feel better. It's really, really important that you still call 911. You have them go in with the medical emergency response team, because the medication can wear off depending on how severe that reaction is, and they could continue to have the symptoms restart all over again. But in your training packet, you should have received, like I said, the trainer model for you to get comfortable with. To reuse it, you're just putting the blue cap back on, pushing the sides down until you hear it click back down again. It's reusable. And you should also have a copy of this flyer, which gives you the 1 through 4 steps on how to administer for your own reference in the future. Thank you so much for watching my video demonstration, and hopefully you all have now felt more comfortable in recognizing signs and symptoms of an anaphylactic reaction, as well as how to administer EpiPen or an epinephrine injection safely and effectively. Thank you so much.